Ketosis and ketoacidosis both involve the production of ketones in the body. However, while ketosis is generally safe, ketoacidosis can be life-threatening. Nutritional ketosis occurs when the body starts burning fat instead of glucose. Inducing ketosis is the aim of a keto diet, which is a high-fat, very low-carb diet that can help people lose weight. Ketoacidosis occurs when the body produces dangerously high levels of ketones, and it is often a complication of type 1 diabetes. In this video we will explain the exact differences between the two, including their symptoms. We will also explain when to see a doctor and how to treat and prevent ketoacidosis. We make videos on topics such as keto, weight loss and nutrition, so if you want to learn more about how you can be healthier and fitter, then like this video and subscribe to our channel. If you are looking for a personalized custom keto diet plan, with the option to swap your meals in case you don't like them, then click the link in the description below. Despite the similarity in name, ketosis and ketoacidosis are two different things. First, let's discuss ketoacidosis and why it happens. Ketoacidosis refers to diabetic ketoacidosis or DKA and is a complication of type 1 diabetes mellitus. It's a life-threatening condition resulting from dangerously high levels of ketones in blood sugar. This combination makes your blood too acidic, which can change the normal functioning of internal organs like your liver and kidneys. It's critical that you get prompt treatment. Diabetic ketoacidosis can occur very quickly. It may develop in less than 24 hours. It mostly occurs in people with type 1 diabetes whose bodies do not produce any insulin. Several things can lead to DKA, including illness, improper diet, or not taking an adequate dose of insulin. Ketoacidosis can also occur in individuals with type 2 diabetes who have little or no insulin production. On the other hand, ketosis is the presence of ketones in your body, which is not harmful. You can be in ketosis if you're on a low-carb diet or fasting, or if you've consumed too much alcohol. If you're in ketosis, you have a higher than usual level of ketones in your blood or urine, but not high enough to cause acidosis. Ketones are a chemical your body produces when it burns stored fat. Now, let's talk about the symptoms of ketosis and ketoacidosis. For most people, ketosis is a short-lived metabolic state that happens when the body temporarily switches from burning glucose to burning fat. During this time, the level of ketones in the blood rises. Ketosis can lead to bad breath and weight loss. It may also cause headaches, thirst, and stomach complaints in some people. Side effects of keto are also known as the keto flu. On the other hand, ketoacidosis is a potential complication of type 1 diabetes, and it can occur if a person does not administer enough insulin at the right times. An illness or infection, as well as some drugs, can also prevent your body from using insulin properly. This can lead to diabetic ketoacidosis. For example, pneumonia and urinary tract infections are common DKA triggers. Also, not eating enough food can sometimes trigger ketoacidosis. The symptoms of ketoacidosis include high blood glucose levels, rising levels of ketones in the urine, thirst and frequent urination, exhaustion, dry or flushed skin. Nutritional ketosis is not a medical condition and does not require a diagnosis. However, ketoacidosis is a life-threatening condition, and anyone with symptoms should seek immediate medical attention. A doctor can use blood or urine tests to determine whether a person is in ketosis or ketoacidosis. These tests measure the levels of ketones, glucose, and acidity in the body. Doctors often provide urine test strips to people with type 1 diabetes to allow them to check their ketone levels. Although diabetic ketoacidosis is a medical emergency that can progress quickly, it is also highly treatable. Doctors usually treat people with diabetic ketoacidosis in a hospital or emergency room. Treatment typically involves insulin therapy together with fluid and electrolyte replacement. Most people with diabetic ketoacidosis will need to stay at the hospital for monitoring. As blood ketone levels return to normal, the doctor may recommend additional testing to determine whether a person has other risk factors for ketoacidosis. Now let's discuss how we can prevent ketoacidosis from happening. People with diabetes can reduce their risk of ketoacidosis by monitoring blood glucose levels regularly and notifying a doctor if they are not under control. They can test the urine for ketones if blood glucose levels are above 240 mg and by avoiding exercise if ketones are present in the urine, and blood glucose levels are high. Taking small precautions like administering insulin according to the doctor's treatment plan and eating a healthful and balanced diet without skipping any meals can go a long way in preventing ketoacidosis. Although ketosis and ketoacidosis both cause ketone levels in the body to rise, they are not the same. Nutritional ketosis is the aim of the ketogenic diet, and it is generally safe, whereas ketoacidosis is a potentially dangerous complication of type 1 diabetes. People with diabetes should avoid ketogenic diets and follow their doctor's treatment recommendations to prevent ketoacidosis. Thanks for watching. If you found this video useful, then comment, like and subscribe as we regularly upload videos on keto and weight loss.